Hi, my name's Drew. I'm one of the rheumatology nurses here in Glasgow. This video is a discussion about methotrexate. Jude's been told he needs to start a rheumatology drug and we're going to discuss methotrexate today. When we do these medication chats, we really like to come along with a mum, dad, one of your family friends, but today Jude's going to do this discussion on his own. Hi Jude. The rheumatologists have told you you're to start a rheumatology medication, and today we're going to chat about methotrexate first.
So what is methotrexate?
It's our preferred medication because it works so well. So it gets rid of the swelling, it gets rid of the restriction. If you get pain, it reduces the pain. It's a really good drug for allowing you to actually get on with life. It's quite slow acting, so we tend to use it after we've done things like steroid joint injections. And if methotrexate is the right medication for you, it should reduce the need for us to inject your joints. When we get your joints better, it means you can have a normal life. You can play sports, you can go to school, all those things.
How do I take methotrexate?
So the most important thing is you take it once a week, but after that you've got a lot of choice. It comes in liquid, which actually tastes okay. It comes in tablets, or it's an injection that we teach you to give yourself once a week.
I'm Gillian, Mia's mummy. So Mia, do you take some special medicines to help your arthritis? Do you remember what they're called? Methotrexate. So Mia has methotrexate in liquid form now because she wasn't tolerating injections, and she also gets adalimumab injections, and we give her folic acid because that stops the nausea and sickness. She readily takes a liquid, so it's a small amount. She'll take it quite quickly, but that day she won't eat much at all.
Does it have side effects?
But about 1 in 10 people can feel a bit nauseous with it, and nauseous is that technical word for feeling sick. And I've got some extra medicines that can help you with that. If it's very bad, we just swap medicine. What we do get lots of is when you've had arthritis, your body's been busy using energy up to attack your joints. And when your body's short on energy, it stops doing things it doesn't need to do, like growing hair. So it pauses that. Your hair doesn't fall out, it just pauses. And then when we get you better, your hair starts growing again. So sometimes when you're brushing hair in the first kind of couple of months of treatment, you get a bit more hair on your brush than you were expecting, or on your pillowcase in the morning, and you definitely won't lose hair. Methotrexate is cleared by your liver. Your liver is your organ in your body that gets rid of the things your body's used and needs to get rid of. So we need to make sure we're doing blood tests, make sure your liver's coping with methotrexate. But there's some other things in life that also can really affect your liver. And I'm going to start with the alcohol chat. We really like you to avoid alcohol as much as possible because that way it keeps your liver safer, so it's giving it less work in combination with having methotrexate at the same time. So we also like to be very careful around the sun. Methotrexate can make your skin a little bit more sensitive to getting sunburn. We want you to wear some sunscreen.
So as a mum, I worry about the long-term side effects of giving Mia methotrexate. And one of them is, will she be able to have children when she's older? We've been reassured she would need to stop methotrexate if she was planning a family, but there should be no issues.
So if you're a girl, but it's really not appropriate to get pregnant whilst you're on methotrexate, it's not safe for your baby. For you as a boy, slightly less important, but if you're planning to become a dad, we'd want you to be doing that not on methotrexate. And if you're engaging with other healthcare departments like the GP or A&E, you need to tell them you're on methotrexate.
We need to include everybody as a family in the journey. For the other children seeing it, this can be quite traumatic. You know, for Mia's little sister, seeing her getting injections all the time, she's a bit worried. She'll always ask if Mia's getting needles and if she's okay. It's been a long journey for me to accept that she needs to take this medicine, but yeah, as you can see, she's happy.